Welcome back, everyone. Great to be here with you today. Hopefully you tuned into yesterday's Cabral HouseCall, where we answered more of our community's questions. We went over, off the top of my head, we went over gut dysfunction, circulatory issues, hip pain, and referred pain down the leg. We also spoke about female hormones. We talked about, let me see if I can refer back here, lightheadedness after meals. We talked about cobalt levels and the hair tissue mineral analysis. And so much more. So hopefully you tuned in. That was episode 1975. If you want to tune into that show, you can go to stephencabral.com/1975. And of course, today's show is stephencabral.com/1976 if you want to read along with those questions. And we're going to dive right into it today. I want to make sure that we get to all of our community's questions, as many as we can, as soon as we can. Today's first question comes in from May 10th, and it's from Lindsay. So we're running again about 6-7 weeks behind or so. Just remember that if your question was, if it came in before May 10th, it has been answered. And of course, if you wrote in after that time, it will be answered on an upcoming Cabral HouseCall on the weekend. First question coming in from Lindsay. Let's see what Lindsay has to say here. Hi there. My background is I'm a 36-year-old female. I have a long history of antibiotic use, mainly for urinary tract infections. I also have celiac disease and was diagnosed at age 19. I'm on the path to getting well, and I'm working with an IHP here in Australia. I've done the starter lab tests and just waiting for the results of those. I've started the CBO protocol and will have been doing it for 1 week tomorrow. My question is, for as long as I can remember, if I let myself get hungry, I get nasty bloating and wind pain, which then get worse when I eat something. Why is this? It doesn't seem to happen if I don't let myself get too hungry. My 14-year-old daughter gets the exact same thing. I'd love to know what causes it. Thanks so much. Yeah, it's an interesting point. I don't know that I'm going to be able to give you the exact answer, but let me give you a couple reasons as to why. So I'm going to give you an Ayurvedic answer, then I'm going to give you a more functional medicine answer. All right, so in Ayurveda, when you go too long without eating, it increases what's called vata, which is wind, which is ether, right? So you even said the word wind pain or air is vata, lightness, airiness. And sometimes what can happen is your body starts to break down additional, right? It can break down additional, even bacteria inside of the gut, and it could cause some level of die-off. That's definitely possible. It's not a likely scenario. It doesn't happen often, but certainly possible. The other possibility is actually that you might have some H. pylori. And this is not uncommon with people with an H. pylori infection in the stomach. Again, I can't provide medical diagnosis on this podcast, medical treatment plans, or medical advice. So just, again, I'm giving you from about 3,000 miles away, my opinion over this podcast. So that's where I would look. Now, it won't show up on the starter kit, which is the Candida metabolic and vitamins test, and the minerals and metals test, which is the best place to get started, yes. But it would show up on a bacteria and parasite stool test. We do mail those to Australia, and you can get that through your IHP if you'd like, and everyone else can get it right at equi.life if they're suffering from the similar conditions themselves. All right, great question. Uchi is up next. At 45, I've had all of these conditions: PCOS, Hashimoto's, high blood pressure, colon cancer, insomnia, skin allergies, constant diarrhea, leaky gut syndrome, and anxiety. I've gone to hundreds of doctors, including 2 functional medicine, but my symptoms continue. I want to advocate for my own health and take it into my own hands. Feeling overwhelmed, I don't know where to start. Address what issues first: autoimmunity, gut, health, inflammation. Would love to get some insight on where to start and focus first. Uchi, I mean, honestly, you've come to the right place. We specialize in the hard to, we don't say the word treat, hard to handle cases. But here's the thing. I'm going to cut right to the chase. If you've dealt with half a dozen to a dozen issues for years now, run the big 5 labs and add, if there's any digestive issues or skin rashes, also add the bacteria and parasite stool test. Okay. Will it be an investment? The answer is yes. Will it cut down years of trial and error? The answer is absolutely. Absolutely yes. And the reason is you're going to be able to figure out all of the underlying root causes. So I know that you've been to 100 other practitioners, but here's the thing. We're going to tell you exactly what your food sensitivities are, your mineral deficiencies, your vitamin deficiencies, how your detox system works. Do you have candida? Do you have bacterial overgrowth? Do you have H. pylori? Do you have parasites? Yes or no? What's your omega-6 to your omega-3 ratio? Do you have heavy metals? You're going to find all of those things out on the Big Five, plus the bacteria and parasite stool test. So you can just go to equa.life/labs and you'll be able to find those out. Honestly, you've been suffering for too long. I mean, that's what I would do. Because if not, again, you're just going to try something else. You might as well pinpoint the actual deficiencies as well as the toxicities. And if you haven't read The Rain Barrel Effect, please read The Rain Barrel Effect. It will make all of this much more crystal clear. Sarin is up next. Me again. I've noticed some pushback in health spheres from doctors that smoothies are overrated. I enjoy them, but they're saying blended fruit and vegetables aren't nutritionally equivalent to the same fruit and veggie left whole even after some of the properties remain present. Blending breaks down insoluble fiber. There's also talk of natural sugars are released from within the cells of the fruit and become free sugars. Is there any truth to this? What are they saying? Or are they just bumping their gums? Keep up the great work. All right. Since I don't know any of the people that are saying this, they're absolutely, I love the term, I've never heard this before, bumping their gums. It's completely insane. It's completely insane to say that if you take this meal, let's call it, I mean, let's just say it's, what we would put in a smoothie, right? Let's just say we put a couple wild blueberries. Let's say we put a half a frozen banana. Let's say we put some spinach in there, whatever you want. And let's just say you throw, I mean, if you wanted to, a couple macadamia nuts in there. I don't know, whatever you want to do. You put in some of your daily nutritional support powder. Here's the thing. And it's almost like, we have to also, that's why I love Ayurvedic medicine and I love all the Eastern forms of medicine, because you also have to you want to blend common sense and like actual nature with state-of-the-art science. When you put food in your mouth, you masticate the food. You chew it up. If I take blueberries, I chew them up. I break down all of those cells, the cell walls, which does what? Releases those enzymes, which then does what? Helps the food digest in my stomach. When I put it in a blender, I do the same, only better than chewing, which takes less digestion. You chew fiber, insoluble, and a non-soluble fiber, which I have a podcast on. Blending is not going to make the insoluble fiber more soluble. It's just, that's not how it's going to work. It's the same food. I'm almost baffled. It's the same food. And you break down the walls using your teeth versus a blade in a blender. And when you put things in your stomach, they're going to be broken down with hydrochloric acid and pepsin as well. And then they meet the first part of the small intestine, which is the duodenum. And then they're going to be broken down further with more pancreatic enzymes. So it's just a lack. I've seen this a lot lately. People are trying to be contrarian and show you that they have somehow this hidden knowledge of science that other people don't have. But no, the only thing that you could say about blending, which again, I'm always giving you the unbiased answer, is that you could oxidize things too much, right? If you blend it up too much, like you keep it on for like 2 minutes, you bring more air in and it causes more oxidation. But here's the thing. If you drink it within a half hour, it's going to really be fine. Or I shouldn't say drink it within a half hour. I should say that don't overblend it, one. If you're going to overblend it for whatever reason, I don't know why anybody would, then you'll drink it in a half hour. What I do is I blend it maybe 30 seconds. Honestly, maybe 30 seconds. All you need to do is blend it till it's broken down, and then I drink it over the course of an hour to time release all of that nutrition. I love these types of questions. All right, Rhonda's up next. Hi, Dr. Cabral. I just started listening to your podcast and just can't get enough of the amazing health information you have made available. Thank you so much. By the way, thank you, Rhonda. Thank you, everyone who writes in and says all these kind things. Honestly, it's energy which keeps me going. It literally is bringing in me, it brings energy into my body, which then allows me, of course, to keep this going. I mean, we've kept it going now this is going on 6 years, almost 2,000 podcasts. All right. I have a question I'm hoping you can answer. I've been reading a lot about menopause, and I'm a bit spooked about what happens to your body when you lose estrogen. Therefore, I was wondering if there's anything we can do to delay menopause as far as the lifestyle is concerned. Also, one of my friends is in early menopause. She's only 44. Is there anything she can do to reverse it? Thanks again for everything you do, Rhonda. Rhonda, happy to help with this. And the answer is basically yes on all fronts. So to get an in-depth answer, I have a podcast. Based on the podcasts I've done, I've put them on iTunes and other places under female hormones or under balancing your hormones. So you can find that right at stephencabral.com/podcast. But there's an in-depth course that I would love you to do. Small investment. It's at stephencabral.com/accelerators. You can also get there by going to stephencabral.com/courses. Look at the one called female hormones. It's going to answer this question from what to do to balance your hormones premenopause, perimenopause, which is menopause, and then postmenopause. Okay, so check that out. I would love for you to take that because it's going to give you in-depth information. If you're not, run these stress hormones, mood, and metabolism. It's going to let women know why they may have gone into early menopause. Oftentimes, it's because of estrogen dominance, which means lowering levels of progesterone, typically in most women, due to higher levels of stress and cortisol, toxins, viruses, inflammation. All of that can be reversed, no doubt about it. So then women can get back their period. However, you can't change Mother Nature, right? So a woman only has so many ovulatory cycles. Once you are done with your ovulatory cycles, then you will naturally move into menopause. Now, what can you do about plummeting levels of estrogen? Well, it's not just plummeting levels of estrogen. It's plummeting levels of testosterone, DHEA, estrogen, and progesterone. So you really want to run that stress hormones, mood, and metabolism test to make sure if you're low on multiple that you bring those up only into natural levels. And we don't use hormones in our practice. We use natural protocols that allow women to produce more of their natural estrogen, progesterone, and testosterone. You might say, well, how do you do that post-menopause, right? Well, if you look at it, the adrenals still produce hormone after menopause as well. All right, so that was a lot of information, but it allows you to kind of enter it at any level that's right for you. Mandy's up. Hi, Dr. Ball. I have a question about my daughter. She is 5 and multiple times each week, she's waking up in the night crying with painful legs and feet. Can you offer any advice? Thanks, Mandy. Okay, I can. A lot of people call this growing pains. You know, and it very well could be. There's no doubt about it. However, these growing pains seem to be worse in children with lower levels of certain electrolytes. Those electrolytes are often and most notably magnesium and potassium. It doesn't mean that your daughter needs to start supplementing with nutritional supplements. However, she does need to make sure she's getting enough. Sometimes it could be as easy as adding more high potassium foods to the diet. You can go to stephencabral.com/podcast and look up high potassium foods there. You can Google high potassium foods as well. Most people think of banana, but there's more than just bananas and coconut water for potassium. But both of those can work. So it's easy to get high potassium from foods, and I recommend it. Banana, coconut water, etc. But I also recommend potentially taking some magnesium for even a child. Now, it doesn't mean that you have to do this, but if you can't get enough high magnesium food, you may want to add a little bit of supplemental magnesium. You can get magnesium gummies. You can take the magnesium citrate powder, which is what I do for my daughters. You can find that at it's at equa.life. Yeah, just go to equi.life and just type in magnesium. You'll see it pop up as magnesium bicarbonate or magnesium citrate. It's just the magnesium powder. And you can just use a half a teaspoon to 1 teaspoon with your daughter. But again, I can't give you medical advice. I'm not certainly providing any type of treatment, and you should always do what you feel is best. So that's what I recommend. You can always run a minerals and metals test with your daughter too to take a look at those electrolytes. So again, hopefully that was helpful. All right, we've answered 1, 2, 3, 4, 5, 6 questions today already. Well, it looks like we are there. So, well, today we got a super fast version of the Cabral HouseCalls. I never gauge how long I'm going to spend on each individual question. I just want to make sure that I gave you my all, that I gave you my best, not as a complete answer, right? It's not meant to say, oh, I know everything about you. I've done a full intake. I've taken your labs, all those things. But it's say, hey, you and I bump into each other in the airport, which happens to be sometimes quite often, or at the end of an event, and you ask me a question just like this, and I give you the answer based on 20 plus years of working with people and having seen pretty much all of these different items and issues before. So again, hopefully this was helpful. If it was, please do feel free to share these shows with anyone you believe they could serve. Take care, everyone. Have an amazing rest of the weekend, and I'll be back tomorrow with our Mindset and Motivation Monday.